In this presentation, I will talk about the third and last principles about the tooth preparation, which are the aesthetic considerations. As I have said before, you should always not prefer the aesthetic considerations to please your patient at the expense of the other considerations, which are the mechanical or the biological considerations. And the aesthetic considerations should always be started by the smile analysis procedure. You should analyze the patient's smile, and you should know and notice the teeth and parts of teeth that show during talking, smiling, and laughing. If you can notice these things, the subsequent work will be easier and more perfect for you and your patient. After doing the smile analysis procedure, you should discuss with the patient the possible treatment that you may have, and you should know as a dentist what are the possible aesthetic treatments that are present. As possible aesthetic treatments, we have only three options. The first one is to use the all ceramic restorations, the second option is to use the metal ceramic restorations, and the final and third option, which is the use of the partial coverage restorations. The all ceramic restorations are, of course, very beautiful and have been developed to mimic the natural and lifelike appearances of the teeth, but with 1 millimeter thickness minimally for a good aesthetic result. We may reduce it, we may increase it, but the 1 millimeter minimum is the standard thing to have a good aesthetic results. And the all ceramic restorations include the ceramic crowns, the inlays, onlays, and overlays, respectively, in this picture. And finally, the veneers, which are present in these two pictures below. These are the possible options in the all ceramic restoration option. You should know that this 1 millimeter minimum is not possible in some situations where the teeth are very small, like the lower incisors, and sometimes the young teeth with big pulps, because we will read the pulp rapidly. The second option is the metal ceramic restorations, which are the restorations that have a metal backing and a ceramic above it. These restorations should have at least 1 millimeter facial reduction, and that reduction should be done in the tooth, and you should not be conservative in this situation, and you should make this 1 millimeter preparation to have a 1 millimeter thickness of the restoration, because if you be conservative and then you make an over contoured restoration, that will lead to plaque accumulation and periodontal disease. Again, this might not be possible in some cases, like the small teeth and the young teeth. Incisally, the reduction should be at least 2 millimeters for the anterior teeth to have a good aesthetics, specifically for the light transillumination thing and concept, etc. And the for the posterior teeth, we should know that this is important to have a good strength for the ceramic at that area to sustain the occlusal forces. But do not over reduce the tooth to do these 2 millimeters, because that of course will lead to poor retention form and poor resistance form, because the tooth will have a less surface area for retention and friction and less height for resistance against rotational forces respectively. Proximally, you should do your preparation for the ceramic part of the metal ceramic restoration just anterior to the contact area, and this is mesially. Distally, you can make it more anteriorly or facially located, because it will be hidden by the distofacial line angle. Marginally, you should always do supragingival preparation, but you may do a subgingival preparation in special cases, like for example when we have a distracted tooth or a tooth with a contact area that is located below the marginal crest that necessitates the preparation subgingivally, or when there are some root sensitivities that cannot be treated by the dentibonic agents, and finally and most importantly when we have an aesthetic concern. For example, for patients with high lip lines that would necessitate the use of subgingival preparations. Okay? And if you have noticed Dr. Teddy from Grey's Anatomy, you would notice that this woman has a high lip line and smiling line, and it is impossible to do an aesthetic restoration for her without doing a subgingival tooth preparation. Okay, so that this is the case where you should do a subgingival tooth preparation, but before doing the subgingival tooth preparation you should have completed all the periodontal treatment necessary for that patient, and you should also tell the patient about the possible not good outcomes if he would neglect his oral health. Okay, the last and third option is the partial coverage restorations, and of course guys, the best aesthetics are the natural ones, so that when we will do the partial coverage restorations or the restorations of the teeth that will prepare only the lingual and proximal aspects of the tooth, leaving the facial aspect of the tooth, this is called as the partial coverage restorations. In this situation, the tooth preparation for the lower teeth finishing line can be seen, and that is inevitable. But for the maxillary teeth, we should do the finishing line just beyond the facio-occlusal line angle, so that it will reduce the appearance of the restoration at that area. Finally, I should admit that this video series would not be possible without the help of this great book in the fixed prosthodontics, and I have made this video series in regard to the tooth preparation step from the steps of the fixed prosthodontic treatment procedure, because the tooth preparation is the most important step during the fixed prosthodontic treatment procedure, that you should have a mind of a physician and a mind of an engineer and a mind of a dentist, and combine all of them together to have the best results for your oral health, for your restoration integrity and retention, and for the patient's aesthetics that you will have. Always try to know, spread knowledge, and construct the world. Always try to be kind to others, and that is for the greatest benefit to the humankind.